Hello, my name is LaWanda Hopefields, and I have the honor and the privilege of serving as the director for the Ronald E. McNair Post-Baccalaureate Achievement Program, also known as McNair Scholars. During this 2019-20 academic year, we are excited to celebrate our anniversary of 25 years on the Wichita State campus. Although during this year, we have encountered many challenges, as most of America has, we are so proud to still celebrate our students, and we have great appreciation for the faculty members who have stayed the course to bring this year's scholarly activities to a close. I would like to acknowledge my boss and mentor, Ms. Delta Q. Colvin, for her support during these most recent challenging times, but also for her confidence in me to lead this dynamic group of students. Miss Ashley Cervantes and Miss Nisha Green are the capable hands behind the scene, and a mere thank you is not enough for all that they do. They are the backbone of our program, and I am forever grateful. As we celebrate 25 years of academic excellence and 15 students who are completing their scholarly research, I also want to thank you as our supporters and as our listeners. Thank you for being there for the students and for the program as we celebrate 25 years of academic excellence. Enjoy these dynamic presentations.
My name is Daniela Vega. My project is College Students' Perceptions of Integrated Behavioral Healthcare on campus. My mentor for this project was Dr. Rachel Petz. The integrated behavioral health approach of healthcare service delivery is becoming popular as a way to bring behavioral health services and primary care services into one setting. The behavioral health consultant is incorporated into the primary care team to support the primary care provider and team and to provide behavioral health services on site. This differs from the traditional mental health and medical care that are operated separately and with little to no collaboration. The integration of mental/behavioral health and healthcare has the potential to improve access and quality of healthcare for people and is gaining traction to become a practical substitute to traditional models of care across a variety of healthcare settings. College students typically seek out basic medical services in a non-emergency situation at their student health clinic. Students are learning how to take care of themselves financially, and this may limit students to seek specialty services from things such as mental care. Most of the time, it seems as though college students do not address their mental health conditions due to barriers such as language, insurance, finances, stigma, and so much more. There is also a lot of stigma centered on mental health and help seeking. This model of care can help give access to mental and behavioral health care to many people who do not have access to it, and as well as for primary care. Recently, student health services and counseling and prevention services merged into the Student Wellness Center at Wichita State's campus. The merger now provides the opportunity for more combined and integrated services on campus. Moving forward with a more integrated model of care at WSU, the purpose of this project was to answer the following research questions. What are college students' perceptions about integrated behavioral health on campus? And are college students just as likely to intend to seek mental health help in an integrated behavioral health setting in comparison to a traditional mental health care? Participants were 74 students at Wichita State University who were 18 years or older. Measures used in the current study were demographics, student perceptions of integrated behavioral health, and intentions to seek help. Demographic questions were asked such as age, gender, race, year and school credits attained, and a few others displayed on the table. 7 questions were created to look into student perceptions of integrated behavioral health. Questions included things such as awareness of the merger between student health services and counseling and prevention services, comfort level, the likelihood to utilize the Wellness Center for health care and mental health care, how beneficial the merger would be, and the potential barriers and benefits. A general help-seeking questionnaire was used to measure the intentions to seek help from another person, personal or professional, for a personal problem. Over half of the respondents were aware of the merger between student health services and counseling and prevention services at WSU. In terms of comfort level in receiving mental health treatment in the same place as medical help, the majority of students felt very comfortable. The majority of students saw that the merger between mental health and health as very beneficial. The highest reported result for the likelihood of utilizing the Student Wellness Center for healthcare showed 28.4% were neutral. In terms of utilization of the Student Wellness Center for mental health care, most students were neutral. The top 3 reported potential barriers of accessing the Student Wellness Center were not having enough money, no time to visit the Wellness Center, and 29.7% reported no anticipation of any barriers. The top 3 reported potential benefits of an integrated health model were easy accessibility to a mental health professional, a primary care physician and a mental health provider collaborating in on the care of a patient, and saving time in seeing mental and physical health in the same office. Other benefits and barriers are reported on the table as shown. There was no significant difference found between the intentions to seek help from a mental health professional in an integrated behavioral health and the intentions to seek help from a traditional mental health care professionals. Researchers focused on 2 main questions for this study. What are college students' perceptions about integrated behavioral health on campus, and are college students just as likely to intend to seek mental health help in an integrated behavioral health setting compared to a traditional mental health? In this study, students' perceptions towards integrated behavioral health care were more accepting on a college campus. The intentions to seek help in an integrated behavioral health setting did not have a difference in the intentions to seek help in a traditional mental health care setting. This study was able to provide some base evidence for the hopeful implementation of this model of care on other college campuses. There is still so much to look into integrated behavioral health care on college campus settings. Future research could focus on the actual service utilizations of integration on campus. It would be helpful to look at what factors impact acceptability and the utilization of this model of care. Results from studies such as this one may help with implementation on other college campuses. Here are my references. I will now take questions. Yes, the results we found were a little surprising. We would have thought it'd be more beneficial for students, or like they would be more willing and to look into these services. So that's what it's a little surprising that results were neutral rather than higher. I do believe so. I mean, it's tough to find mental health services on a college campus, so making this a little more accessible for students to receive mental health help and physical health care in the same setting could be very beneficial in terms of finances, time, finding a primary care provider. Thank you. This has been my presentation of college student perceptions on integrated behavioral health on campus.